Hi, my name is Margaret, and today I'm going to give a speech on the Affordable Care Act, otherwise known as National Healthcare Reform. So here we go. The Affordable Care Act. Just how affordable is it? In January 2014, our whole healthcare system will change. The Affordable Care Act, launched by President Barack Obama's political party, will lower the quality of healthcare for all Americans, increase the nation's debt drastically, and lower the rate of full-time employment. To start with, the new healthcare reform law will lower the quality of healthcare insurance for all Americans by raising premiums and reducing patient choice. The new law adds a large amount of healthcare services that insurers must cover, and in some cases restricts the ability of the insurers. The effects of the new law will be a one-size-fits-all coverage, so that the patients are not confused by having choices. So we're reducing patient choice here. And the elimination of the employer's freedom to design their own insurance plans. The law also creates an open market for the lobbying of essential benefits by medical providers to Congress and the Department of Health and Human Services. The more benefits providers are able to have deemed essential, the more insurers, employers, and patients will have to pay for these services. The result will be higher premiums for millions of American taxpayers. People not in desperate financial need will suffer greatly as their premiums skyrocket in the middle of a recession. Secondly, the nation's debt is currently averaged at about $17.1 trillion. The Affordable Care Act, or Obamacare as many like to call it, plans to increase this debt by about 11% by 2023. The reason the debt will be increased so much is because of the massive expansion of Medicaid and government subsidies. In addition, the Congressional Budget Office and the Joint Committee on Taxation predict that the new taxes from the Affordable Care Act will raise $771 billion in new government revenue from 2013 to 2022. Many of these taxes fall directly on the middle class, while others will affect taxpayers indirectly through increased costs for goods, higher insurance premiums, or lost wages. Lastly, the new healthcare reform law will lower the rate of full-time employment drastically by requiring employers to offer full-time employees health benefits that meet the minimum standards criteria. If they don't meet these standards, they pay a penalty. In addition, the government has already effectively raised the minimum wage above $10 per hour, without workers getting benefits. The Affordable Care Act proposes raising the national minimum wage to $10.10 per hour. Joined with the employer penalty and existing taxes, this would raise the minimum cost of hiring a full-time worker to $12.71 per hour. Few workers in minimum wage positions create over $12 per hour worth of value for their employers. In many cases, paying that much would cost businesses more money than the worker was worth. In response to this, employers would eliminate jobs and cut workers to part-time status, making it more difficult for unskilled workers to get ahead. To conclude, the Affordable Care Act may seem like it has good intentions with every citizen in the U.S. getting health insurance and full-time employees getting more benefits to support them and their families. However, one finds that the intentions get distorted when premiums are raised and patient choice is reduced. National debt increases by 11% and employment decreases as employees cost their employers more than they produce.